Hello, my name is Julie Ramsey, and welcome to Health Insurance Providers and Plans. Some key points in this session is that the gatekeeper is the same thing as the primary care physician. An HMO is, you want to know that an HMO, always think of preventative care. With a PPO plan, doctors reduce their fees to be on an in-network list. And in a POS plan, it provides both in-network and out-of-network coverage. Now let's get into some details. Health insurance, it pays benefits for the loss of income or medical expenses. They could be called accident and sickness insurance or accident and health insurance, but there are different kinds of coverages that are available. Definition of perils. A peril is a cause of loss. For example, an accidental injury. If it's an accident, it's unplanned, it's unforeseen. If it's a true accident, you don't know when it's going to happen. That's why it's an accident. Sickness. To be covered, sickness must have first manifested itself during the policy period, after you bought the policy. You see, we don't want someone to get sick, and that's why then they go buy the coverage. Determining health insurance needs. It protects the insured from risk of medical and disability expenses. So a producer would sit down with a client and do what's called a needs analysis. And this agent would say, okay, let's find out what your goals are, now short-term, long-term, all right? What do you need? What do you currently have, and what can you afford? Based upon those, that producer would make a recommendation. And when done correctly, it provides benefits exactly when they are needed. Commercial insurance companies consist of both stock and mutual insurance companies, and they provide coverage on a reimbursement basis. Now, reimbursement means this. I go to the doctor or to the hospital and I pay the full bill. I contact the insurance company and I then get reimbursed for that. Covered individuals are referred to as insureds, and they offer both individual and group health insurance products. Blue Cross and Blue Shields. Now, there are some differences from commercial insurance companies. Their benefits are provided on a service basis instead of a reimbursement basis, which means the insurance company pays the doctor or hospital directly for the medical treatment. It's not like in the other plans where I would go pay the doctor or hospital and get reimbursed. The doctor or hospital pays them directly. They have contractual relationships with the hospitals and doctors. Blue Cross pays the hospital, Blue Shield pays the doctor. They're prepaid plans. The subscribers pay a set fee for medical services that are covered, and members are referred to as subscribers. Health Maintenance Organization manages health care and its costs through a program of prepaid care that emphasizes prevention and early treatment. When you think of HMO, always think of preventative care. HMOs led the way with preventative care, and they said the sooner that we catch it, let's do a treadmill test when you're 65, let's check your heart, or every year let's do a physical and make sure that you're healthy, because the earlier we can detect it, the cheaper it is and the better it is for everyone. HMOs typically have copays. If you go to the doctor, you pay a small copay. You go to the hospital, maybe it's a little bit larger copay. Copay, you pay it, and then you're out the door. But an HMO handles both the financial arrangements and makes available the health care services. So that HMO will have an agreement with that doctor, and they say, we will pay you X amount per subscriber that could possibly come to see you. Now, this doctor does not get paid any more money if client number 1 wants to see that doctor 1,000 times that year. He doesn't get paid any less if patient number 2 sees the doctor at all, doesn't see him at all that year. That's known as capitation, okay? Think of capitation means by the head. So when we're calculating how much should we pay that doctor, that is based upon how many people can come and see him. It does not vary, though, with how often that these clients will go and actually see his or her doctor. The gatekeeper. The gatekeeper is the same thing as a primary care physician, which means if I name Dr. Jones as my gatekeeper, before I can go see anyone else, I have to go see my gatekeeper, Dr. Jones, before I can see a specialist or anyone else. HMOs are known for preventative care, but they must provide some basic health care services like inpatient hospital, physician services, outpatient medical, preventative health services, and out-of-network coverage, but only if it's an emergency. Because remember, we said we know how those doctors are paid. The HMO says we'll pay you X amount, so they have to be a part of that network because that's how they get paid. You're going to notice that there is a chart, just to simplify here, but it says in-network and out-of-network. To simplify, in an HMO, you have a small copay. The doctor, the hospital, you go in-network, you pay your small copay. To have coverage out-of-network, the only coverage you would have if it's an emergency. Preferred Provider Organization, or PPO, they're independent hospitals and doctors who've agreed to reduce their fees. Now, why would they reduce their fees? Well, they're doing that because they want to be on the in-network list. And they could be traditional insurance companies, Blue Cross and Blue Shield, HMO, whatever. But providers are paid on a fee-for-service basis. Now, fee-for-service means they get paid every time I come to see them. That's how they get paid, fee-for-service. Okay? So again, they're doing this because they want to be a part of this network. They'll get clients, and of course, they're getting paid from that insurance company. Can you go out of network in a PPO plan? Yes, you can. You can go to anybody you want to. But if that doctor or hospital is not on the in-network list, you're just going to have to pay more out of your pocket. So if you go in-network, it's a smaller out-of-pocket expense. Out of network, you can go to anybody you want to, but you will pay more out of your pocket. Now, in a POS plan, point of service, it's a plan that has characteristics of both the HMO and the PPO plan. It's like a hybrid, you know? And if you go in-network, you have a small out-of-pocket expense, and if you go out of network, you're going to pay more. You do have to name a primary care physician, also known as a gatekeeper. A high-deductible health plan. Think about this. What if we were to increase your deductible? Okay, let's make it a really high deductible. Does that affect your premium? Yeah, it does. It lowers your premium. It makes it affordable, right? Now, only preventative care is covered as first dollar coverage. Everything else, the deductible would have to be met. So the good thing is you're saving money on this policy. The bad thing is I have a huge deductible. How am I going to have the money then to pay for that? So it would pay first dollar coverage for preventative care, you know, like well baby visits, etc. But everything else would have to meet the annual deductible. Health Savings Account, HSA. I want you to think of this as two separate parts, two separate elements. There's an insurance piece and a savings account. The insurance piece, again, has a high deductible. If we increase the deductible on our insurance plan, we know exactly what that does to the premium. It lowers the premium, all right? We know that premium, though, has to be paid every single month. It's insurance. So there's one part of it. The second part is the savings account, right? If I have a high deductible, how am I going to come up with the money in order to pay that deductible? Well, we're going to use the current tax laws that says I can have a savings account, and money that goes into this savings account, this money is not taxed ever if I use it for a medical purpose. So here I'm saving money on my insurance policy because I have a high deductible, so I have a low premium. And then how do I come up with the money to pay for that deductible? Well, I have this savings account, and if I use it here on a medical expense, that money is not taxed. Some people will ask, well, what if I want to take this money out of my savings account go on vacation, do whatever with that money? Can I do it? Sure you can. It's your money. But if it's non-medical, there's taxation and possibly a penalty. Health Reimbursement Account, HRA. This is a consumer-driven health plan, and it reimburses employees for qualified medical expenses that are not paid by their insurance policy. It's paid through an account, though, that's funded by the employer. What does it pay for? It pays for co-pays, deductibles, medical exams, vision, dental expenses, and etc. Just to recap, The gatekeeper is the primary care physician. This doctor sits at the gate, and before I can open the gate, before I can go see another doctor, I have to get this doctor's permission, a referral. And HMO is known for preventative care. PPOs are a group of doctors who've agreed to reduce their fees to be on the in-network list. Point of service simply means they have in-network and out-of-network coverage. Thanks for joining me.